Well, it's a Sunday, and I'm very glad to say we have our chance to our regular catch up with the Minister for Health and Social Care, David Ashford. David, as always, I've got some questions, but in this section, I think it's just a quick update. Massive amount of confusion about who can bubble with who, single people with. I mean, I was getting lots of calls. I think you've had hundreds of emails about this, and there was a little bit of an update from the government. It's a bit of a pity that it wasn't quite precise enough. Maybe you would take just a second or two to explain to everyone who can bubble with who.
Yeah, I'm happy to, Paul. It is quite a simple concept. At the moment, it is limited to single person household, so where someone's living on their own, or a lone parent household where it's a single parent living with children. They can bubble up with any other household. So that doesn't mean it has to be another household that has one person in. They could, for instance, bubble up with their parents. It might be a 2 or a 3 person household. What that would mean is that entire household would then be bubbled with them. So if you're bubbling with a multi-person household, then those people within that household can't choose different people to bubble with. They are linked to that one person. So I think that's where the confusions come in, because the reference to household doesn't mean it's got to be another single person household. It can be a household with multiple people in. It just means that all those people in that household are then bubbled to that one single person.
And that's come into effect straight away, right?
That came in at midnight on the Friday.
Ah, right, okay. It's going to be completely unenforceable, of course. I mean, this is just down to common sense, I'm taking it.
Well, I would hope people would be responsible. I mean, it is enforceable if people are caught. It's there in regulation, so people would be committing an offence if they breached it. But I would hope that the general population would be sensible about this. The reason we've brought this in isn't to create household mixing or to give people a free-for-all. As the Chief Minister explained at the Friday press conference, we are concerned, and as Minister for Health and Social Care, I myself am very deeply concerned about the mental health of people. People have been through this. This is the 3rd time now, and some people's mental health is suffering, particularly those that are on their own, that haven't got that human interaction day in, day out. And the aim of this is to actually help them. It's not about general social interaction. It's not about trying to create more mixing. It's about giving them a support network that they can actually rely on.
And of course, at the same time, you announced that the extension to the lockdown is putting people under even more pressure. I'm taking. Are we expecting to see some other sort of slackening of the rules as the time goes on, or do you not know that yet?
Yeah, well, it's very hard to say. I mean, as you know, Paul, things change daily throughout this, and the answers to things can change daily as well, as we've already discussed. But I think, it feels a lot more like last year, where it'll be a slower relaxation, where it'll be done in phases. So it feels more like last year than it did of January, where we were able to release all in one go. So I think what will probably happen, again, to use that dreaded phrase I've become so well known for, of baby steps, I think that's what it will be. This is the first stage now with bubbles, and then we will see how it goes. We've got to stress again, of course, one of the things we're looking at is cases emerging in the community of unknown origin. Those are the cases that concern us. People who are already isolated, where there might be household transmission, aren't as much of a concern. It's those cases where we don't know where it's come from or how the person's contracted it. That's the cases that would be of concern.
We had a letter, and we dealt with it a few weeks ago, about the conditions at Nobles Hospital, about someone using a commode and the showering and that situation. You said you weren't sure, or you were certainly looking at it. You came back, you hinted last week that indeed there is problems at Nobles. Can you give us any assurance that things are improving, or are people's sort of personal spaces still compromised by having to use these sort of facilities?
I need to be absolutely clear. The problems at Nobles are not to do around patient care. The problems at Nobles are pressure on staffing, and obviously trying to keep other services run while we're doing a COVID response. In terms of patient care, the issue you particularly raised at the press conference there about the commode, Paul, I had that looked into and investigated, and from an infection control point of view, it was the correct procedure. Because what we've got to remember is a lot of the patients who are in hospital with COVID are receiving what's termed oxygen therapy. So they're connected up to the oxygen supplies. If they were to require to use the facility, that requires a member of staff in full PPE, so full medical grade PPE, to remove them from the bed, remove the oxygen supply as well, because they can't be disconnected from that, take them and the oxygen supply to the bathroom, then obviously let them do what is required, then return them in the same way. That entire bathroom then, before it can be used by anyone else, has to be absolutely deep cleaned to infection control standards. So realistically, that is not in all cases practical, particularly when you've got to actually transfer the oxygen supply as well. So in those instances, something such as a commode would be used in the same way as you would with other conditions if someone was bedridden.
And the shower issue, did you find out more about that? That people hadn't got access
The
to
shower
showers?
issue, I've been unable to find anything on whatsoever in terms of someone being unable to get a shower. I've had infection control look at that. I know the senior nursing staff have looked at that, and I've been unable to find any further information on that.
And is this a sort of the usual thing for other hospitals, or is this because we don't have enough people working at the moment, or what? Is this standard?
This is standard practice. This is standard practice. This would apply equally in an NHS hospital in the UK. If someone is bedbound effectively via the oxygen supply, these are standard infection control protocols that are in place. You would not have a difference between other hospitals.
Okay, something that's really very live at the moment is the situation with the bus drivers and the amount of people testing positive. And there's been a lot of criticism about going to contactless payments so late. Your comment on that?
Well, I can't comment on individual cases, so I can't comment about the individual situation with bus drivers. And in fact, I couldn't anyway, because I'm not entitled to that information myself. So I personally don't know how many, if any, bus drivers have tested positive, because I can't be shared that information with. What I would say is DOI has made the decision to go to contactless payments. There is not, there isn't much evidence out there that COVID can transfer via money. There's been some scientific studies, but it's been completely inconclusive of the fact that the virus can actually survive on change or cash. From an operational point of view of DOI, contactless is the most efficient way of doing it, because they're not having to deal with cash handling and everything else. That's a decision they've made, which I think is both not just around transmission code, but also efficiency on the buses. And I can't really add much more to that, because obviously I wasn't involved in that decision-making process as Minister for Health.
Indeed, but as part of Coleman, I mean, in the lockdown one, it was put over to contactless very quickly. Here it appears to have been a bit of a late decision.
Yeah, I would assume, and again, I can only assume, because again, it's not even a Council of Ministers decision, it is an operational decision for DOI, so it's not something that would have to come to Council of Ministers for approval. In relation to it, I would assume, like I say, it's not just around potential transmission of COVID, because don't forget last year, the reason we did it so quickly was because there was concerns that COVID could potentially pass by people handing over change or handing over notes. The science for that doesn't seem to back that up at the moment. But there was concern about that this time last year. This time, I would say, if they have got a large number of staff isolating, there's also operational issues, because if you're cash handling, it's not just a case of paying the bus driver. After the bus driver finishes that shift, that money's then got to be dealt with. It's got to be reconciled. It's then got to be banked as well. So there's a whole process that sits behind that. So I would personally say, although like I say, I can't say for certain, it'd be better speaking to the Minister for Infrastructure around this. I think it's not just around potential transmission routes for COVID. I think also from a practical point of view, there's operational things in there, which if they are under staff pressure, they could release those staff to be doing other things.
All right, well, I'll put another request into the Minister for DOI. I've got some already in, but I'll do that again, because it certainly seems a concern to the bus drivers at the moment. Without going to our question section on this one, it's a question you're being asked every time, and it updates, of course, as and when, and that's why we're doing this. This worry about the lack of supplies coming up for a month and how that's going to affect your numbers. I think people just want to hear the, where we're going with this one, and how much notice will you have that you're not going to get the updated amount, or will you know long time in advance, exactly-ish, anyway, where you're going?
So I take this as referring to vaccines, Paul. We do have the revised schedules now, but again, I have to caveat those schedules change daily sometimes. I think I've mentioned before, we actually had the schedule changed 3 times in the same day on one occasion. We are aware of the disruption. The UK informed us early on that this was likely to occur, so we've been able to put contingencies in place. We've used our other contingency as well, which was one of the reasons we went for the 10-week gap in dosing, because it gave us a bit of flexibility if we wanted to push it to the 12. We've done so on that so that we can carry on with first and second doses in line with it. At the moment, assuming there's no further disruption, we will be able to continue as normal, just at lower levels of vaccination than we have been seeing with the 1,000 a day. But that is exactly the same for Jersey, Guernsey and the UK. We are doing exceptionally well at the moment with the vaccination programme. In terms of overall doses, as of this morning, we have delivered overall doses across first and second doses equivalent to 47 in every 100 people. And in terms of first doses, we have now delivered first doses to a third of our population. And in our second doses, about 15% of our population have now had the full protection with the full 2 doses. So the vaccine programme is rolling along nicely. We were expecting all along there would be some forms of disruption, but it doesn't particularly change the vaccination programme that much. Whichever way, we've planned out all the different scenarios, and whichever scenario we end up in, it changes it by literally a matter of a week, maybe 2 weeks at most. So it's not a major disruptor to the vaccine programme. It may extend things out by a week, 2 weeks, but we're not talking months here.
We keep hearing, I mean, the UK's done over 50%. I know you're going to come back and qualify that, but the fact is it because we've got an older population here in the Isle of Man that we're not quite on the same levels as the UK? I'm just thinking
Right, we need to be careful with the UK's 50% because the UK isn't referring to 50% of the population or 50% of doses across the population. The UK is actually 6% behind us as of today on the overall dosing. I think they're roughly at the moment around about 41, 42%. 42 out of every 100 people. What they're referring to with the over 50% is the over 50% of the first phase cohort. So that is those aged 50 above and in the vulnerable category. We're actually now level with that. We are 49% about to tip over into 50. But our age profile does play into that. So we do have, as a percentage of population, more people in that vulnerable cohort. In total, the vulnerable cohort on Ireland is roughly around about 42,000 people. So we just need to be careful with the percentages because different people are talking about different things. When the UK is referring to the 50%, they're not referring to 50% of the population having been vaccinated. They're not even referring to 50% per 100 people of first and second doses administered. They are purely referring to that phase 1 cohort, and that is the percentage we're pretty much on. If I remember rightly, as of this morning, I think it was 49.04% we were on.
Just before I touch on another subject, any indications you want to give us about where we're going with numbers today? Are you comfortable where we're heading with the unexplained?
I haven't had any update yet, Paul. The update for me on a Sunday normally comes through around about 3 o'clock in the afternoon. So I literally haven't got the figures for today yet. Obviously, it is concerning that there is still some popping up. I think it was 4 yesterday of the unexplained. That is a concern because it still means there's obviously something going on. The Director of Public Health talks about the fire burning underneath. Well, there's obviously still at least a smoulder if those cases are emerging, because when you're in a circuit breaker, if everything is being applied correctly, then you shouldn't now be seeing unexplained cases because we're more than 2 weeks in, so we're more than the incubation cycle. And
yet we've all seen Jersey and Guernsey and exactly this scenario played out down there, didn't it? It went on for much longer than it should have done because they kept cropping up.
We have. I mean, if you look at our curve, I'm sorry, that really does take us back to last year, referring to curves, doesn't it? But if you look at the way the curve is going at the moment, we are coming down quicker than Jersey and Guernsey did off their peak. But we can't take things for granted. We need to ensure that we do things in a measured way, because what we don't want to do is to do something and release something that then suddenly turns that smoulder underneath into a full-blown fire again, and we bounce completely back up the other way. So that's why we're taking steps that we are. And like I say, the bubble at the moment, it's there really for people who've got mental health problems, need the human interaction. It's not meant as just an opportunity for people to socialise.
Okay, I just want to move quickly on to medical cannabis. You're disappointed that things haven't moved quicker. So while I've got you here today, can you explain what's going on?
Yeah, I mean, my views are on public record and have been for a long number of years, long before I was Minister for Health and Social Care. I'm happy to put them on record again. I'm personally in favour of medicinal cannabis being more widely prescribed. We did, before COVID struck, have consultations with the GPs, whether they would be willing to prescribe at a GP level. That didn't find favour with the overwhelming majority of GPs, and I answered a question on this in Tynwald last week, where it just didn't find that sort of level of favour. Same when we consulted with consultants as well. I am keen to move it forward, but if we are going to move this forward, firstly, we need to have the medical professionals on board, because there is no point having the most, a very liberal prescribing regime and no one willing to prescribe it. Because whether or not you prescribe a drug is still, and whether it's appropriate for that patient, still rests with the GP. And I think that's an important message to make, because even if we do prescribing, it doesn't mean a free-for-all. It doesn't mean people will be able to turn up and demand they be prescribed medicinal cannabis. Medicinal cannabis would be treated the same as any other drug. So the doctor would need to do an assessment, and it would be down to the medical professional to decide if it was right for your condition, not for the patient to decide if it was right for their condition. So that's actually, that's a very important point to make. But the simple fact is, with the pressures DHSC has been under for the last 18 months, as much as I have my personal views as Minister, I've got to be practical, and we just have not got that spare capacity to be able to be moving anything forward in this on this at the moment. If I try to put the staff under pressure in that way, then something else will just end up giving.
And to finish with, just make it absolutely clear, because I get asked this all the time, cannabis being sold to the general public is never going to happen until the UK can change their rule, or do change their rules, because of the system of having our customs agreement with the UK. That is correct, isn't it?
Yeah, we would potentially imperil our entire customs relationship with the UK. It's been quite a number of years, I think, since the UK was last spoken to, but certainly I remember being told at the time that the last time the conversations were had with the UK was quite clear that if we ended up differentiating from them in that area, then they would have to reconsider whether the Isle of Man could remain part of the customs, the common customs area. Yeah,
because put simply, you could be having a spliff here and get off the boat in Liverpool and technically be arrested, couldn't you? I mean, that's how.
Well, you would. You'd be committing an offence if you changed over jurisdictions.
Okay. Well, we'll leave this. Don't forget, we've also got a Q&A coming up in the next section here with David Ashford, the Minister for Health and Social Care.